Yeah, dude, YouTube, welcome back to my channel. For those of you who are brand new to my channel, you've never seen any of my videos before, welcome, hello, hi. My name is MelisaMarie. I make videos on YouTube mostly regarding nursing, nursing school, nursing journey, week in the life vlogs, day in the life vlogs. I'm also in a relationship, so I do post a couple of things here and there, not too much, but you know, you might see a little razzle dazzle, a little wedding stuff in there. So if any of that interests you, make sure you smash that subscribe button, hit the post notification bell as well, so you can be notified every time I post a video. And without further ado, I'm going to be recapping my community health course. So community health at Chamberlain wasn't bad at all. We of course went through the history of the inception of community health. We talked about historical influence, which is super important across the board because that'll make or break someone's health outcomes. So basically it's just saying it's important that you get the backstory before making any assumptions or before developing a care plan for a patient. So for example, if you're looking at some statistics and it says that Black people are less inclined to get vaccinated than white people, you can't just look at that and say, oh, the Black people are non-compliant, or they don't care to follow the rules, or they don't care about their health. You have to look at it on a historical spectrum and say, like, well, there's an overwhelming amount of history that shows that Black people were taken advantage of, whether it was like the syphilis study, the Tuskegee experiment, or whether it was, I don't know if you're familiar with Hopkins. Hopkins is infamous for snatching Black people off the street and performing experiments on them, particularly children. And that's how a lot of medical advancements were made, but at the same time, the Black community suffered for it. So there's a really large gap in trust in certain communities. So that's an example of historical influence on the health. So that's something that we cover pretty in depth. We did a couple of case studies on that. We also went through epidemiological models as well. So the triangle was something that we covered. I'll probably put a picture of that like right here so you can see what I'm talking about if you don't know. We talked about different data collection methods and which ones you would use for a community assessment. Like, you wouldn't want to do a full head to toe type of thing, like especially depending on the environment. Like if it's a disaster, baby, we don't have time for all of that. You gotta jump in, focus assessment. We talked about communicable diseases. That's a huge part of community health. So obviously, of course, we talked about COVID. We talked about other recent epidemics as well that have happened, or pandemics and endemics, which if you don't know the difference between those, I'm gonna put endemic, epidemic, and pandemic on the screen so you can see them. As far as communicable diseases that you see in the hospital a lot, mostly this is like your hepatitis. You have your hep A, your hep B, your hep C. You want to know the modes of transmission of each of those. So which one you get from fecal oral route, which one you get from blood, which one you get from food, well, fecal oral, but which one you get from contaminated waters and food and stuff like that. Other big communicable disease is tuberculosis. That's a big one. With stuff like that, you know, you're going to have trigger words always in your test questions. So the test is basically going to try and get you to let them know that you understand how to prevent the spread. So if you see a question about TB, more than likely it's going to be asking you, okay, what kind of precautions are you using with them, what kind of a room. You need to know it's airborne precautions, negative air pressure room for sure. You don't want to circulate that molecules into the air. You want to keep it contained. You want to know about N95 masks and what to put on the patient. Like if the patient has to get an MRI, don't put an N95 on that patient. Put on a surgical mask, you know, just stuff like that. We then talked about determinants of health. Determinants of health would include the patient's history, but also like their culture. So whatever they practice in today's present time, their religion. It could also be their race as well, because you know, like for example, African American people have a higher rate of sickle cell. Jewish people, they have like Tay-Sachs. I don't even know if Tay-Sachs still exists, but you know, you have different things in different cultural groups. We also talked quite a bit about healthcare policy and legislation. Super relevant for today's day and age, considering what the Supreme Court just did the other day. So that was very interesting for me because I like politics. I'll talk about politics all day long and you can't stop me. We talked about environmental health. So this had a lot to do with the air quality, water quality, the ozone, sunlight, how much sun people are getting, the rate and incidence of skin cancer, how to educate patients if they tan and stuff like that. We then dove in a little bit more and defined more specifically what a vulnerable population is. So vulnerable populations include those who are more easily susceptible to being abused. So the older population, elderly, children, of course, those who have chronic conditions, those who are disabled or who are mentally delayed. I can't think of what the actual proper word is right now because we're not saying MR anymore. Those who don't have a normal active mind, more or less. So it might even be like something very mild like an autism or Asperger's. We definitely talk about them because you need to be an advocate for those patients. Community health is interesting. You're gonna see it everywhere because you need to have these qualities and these ideals down pat no matter what your specialty you're in, because even if you're in mother baby, you're gonna see psych patients, you're gonna see patients who are on substances, you're gonna see all of these different kind of patients. So you got to know how to properly be therapeutic and interact with them no matter what your specialty is of choice. We talked about reducing health disparities in certain vulnerable populations, so what we can do to make their outcomes better. We talk about the role of the community health nurse, which mainly is advocacy and education. It's really important as well that, especially depending on what community you're getting involved in, you want to make sure that you're very immersed in their culture so that you're not like just as outsider who they're looking at as a foreign body. You want to be able to connect with them and connect with them on their level, not at what you want but as they need, you know what I mean? So, and that's the best way for you to reduce those healthcare disparities, as well as the best way to be an advocate, because then they'll feel comfortable telling you, hey, we don't understand this, or hey, I'm having difficulties affording my insulin, and all that kind of stuff. So you want to be able to get down onto their level. We talked about occupational health nursing and health hazards in the workplace. This includes in the hospital setting, of course, but it also includes people who have jobs that are hazardous, such as in a factory with heavy machinery and equipment, or with chemicals and stuff like that. We talked about forensic and correctional nursing. Nursing in the jails is super important. It's super dangerous at times. I know my professor was talking about one of her co-workers who got thrown into, what was it? She got thrown into the glass or something like that by the inmate. Correctional nursing is definitely super important. Usually those nurses are escorted by security at all times, so it's safe-ish, but some of these inmates are quick, so you never know. Faith community nursing, which is really important, especially during bereavement time. So if you are a part of a church or you are very close to a church body, then you will be the one that they leaned on for final preparations if a constituent passed away. School nursing is super dope. That is where you're going to have to do a lot of tertiary care, because the patients are usually already sick when it comes to school-based nursing. Though, I mean, you'll have some secondary stuff, which will be like screenings, but it'll be basic stuff like hearing, vision, weight, little stuff like that. I don't know if you remember when you were in school and they did those kind of health screenings. But as far as tertiary care goes, a lot of kids have asthma, a lot of kids have diabetes, and so you may need to administer insulin or watch them administer insulin, watch them take their blood sugar, educate them on the signs and symptoms of hypoglycemia, hyperglycemia. Yeah, all of that's very important. In school nursing, it's very important that you are a good teacher, because it's definitely a great opportunity to reinforce that information for them. We then did hospice and home health nursing, so death and dying always comes up. We then talked about disaster preparedness. So of course you have to learn how to triage a situation if there is an emergency, how to tag patients, whether to give them a green, yellow, red, or black tag. what signs to look into to know, okay, that patient's not going to make it, or this patient will make it but they need immediate help. We also talked about different ways, depending on what the disaster is, to contain the toxin so that it doesn't spread further. So that would be like more like bioterrorism. Then we went into global health trends, global health organizations. So FEMA, well, that's not really global, but federal. FEMA, global would be more like the WHO. Yeah, I guess that's like the main global one. But then there's also the CDC for federal, for the United States. And yeah, so that's really the main things that we covered in community health. I didn't say this at the beginning, but of course we started off with a Med-Calc exam like always. Wasn't bad. Just make sure you take your practice beforehand. Also, for our RUA this session, we had to do a group project, which ghetto 0 out of 10 recommend. But the group project was one where we had to go into a community, pick a community, and then spend some time learning about the community, what kind of issues you see there in the population, describe it, yada yada yada. So we particularly chose a neighborhood that is super condensed with a lot of minorities, mostly, I believe, mostly Spanish people, Latino people, and also had a lot of drug users as well. So that's really what we focused on. It was just a neighborhood outside up North Jersey, which, not Trenton, Hoboken. I don't even remember what the name of the community was that we chose, but that's what it was. So we were able to kind of volunteer. So some groups actually did like soup kitchens and drives. There's Catholic charities, and they were able to get more of a feel of what a community health nurse would do in that kind of setting where they're helping directly with the clients. So that was cool. Then we had to present it, which was not cool. You know, I don't really like to present. Couldn't tell, but yeah, I'm not really into that, but it was okay. We then had also a bunch of case studies as well. So like client with asthma, client who inhaled a mysterious substance, and what you would do in that scenario. So it was really a lot of scenario based education, and at the end of the day, it really is just making sure that you're including a patient as a whole entity and not just looking at their current signs and symptoms. You have to think about their culture and everything else that comes with it that has brought them to this point, basically. As far as difficulty goes, it's not a very difficult class. I mean, again, take my words with a grain of salt. Use your own discretion. I did not read the textbook, not nan one time. I'm just saying. I did use my ATI book quite a bit, especially when preparing for the CMS as well. I did use my ATI book. I used a few of the questions from adaptive quizzing, but there was not that many. There was like, I don't know if it was like 47. I don't know. There was like a little amount. So I had to like intentionally go and find questions. So I was like on Quizlet and other places trying to bolster my practice just to make sure I'm understanding how questions are going to be asked. And at the end of the day, I feel like it's mostly just questions based on how to improve outcomes of patients. So as long as you pick the answer that is best going to improve their outcome, then you're going to get the right answer. So yeah, I guess that's really it for community. It's not too much to say. If you have any questions, make sure you please comment them down below. Thank you so much for watching. And again, if you're new, don't forget to like, comment, and subscribe, baby. Come on, join the fam, join the militia, and I will see you in my next video. Look more.